few different answers as to why you as a parent should consider vaccinating your child for COVID-19. One is that about 30% of people who get COVID-19 end up having long-term symptoms from it. So this is very different from, say, the flu, where you get sick very quickly. You're sick for, several days, maybe a week at the most, and then you're pretty much back to normal and good to go. A third of people who get COVID-19 continue to have long-term symptoms that could be one of several different body systems. It could be something related to the heart, ongoing inflammation in the heart. There is a complication where the coronary arteries around the heart can develop aneurysms. We're seeing neurologic issues long-term, issues with chronic headaches, even brain fog, so difficulty processing information, difficulty being able to kind of think through things and perform the way you're used to. So, think about the impact of that on your child at school. And then, also things like chronic fatigue, people not being able to get back to their normal daily lives because they're just too tired to do so. And again, in our teens, that can have a really devastating impact on top of everything else they've been through in the last year with not being in school, being isolated from their friends, and just the struggles of trying to live your normal school life through a computer screen. So I think that just the ability to prevent having that complication is a good enough reason to consider the COVID-19 vaccine. It is difficult to get to full levels of herd immunity without including children in the vaccination plan. So if 100% of adults were vaccinated, that might be pretty close to herd immunity, where we could protect our children actually by immunizing ourselves as adults. But knowing that it's rare for any age group to be 100% vaccinated, then we have to bring other people up into the vaccinated population. And in this case, that includes teens and children as well. So not only is there a reason to protect your individual child from the potential complications of COVID, but there is a broader community-based reason to consider vaccinating, because our path out of this is one that we have to all travel together. And the more people who are vaccinated and protected, the quicker we get down that path and get back to what we have pretty much known as normal activities and normal life.